We often think of our bodies in terms of how they look or perform. But beneath the surface, a constant, silent conversation is happening. A conversation of chemistry, electricity, and biology. Your body is always talking to you. The question is, are you listening? To understand this conversation, we need to learn the language. Think of your body as having a highly sophisticated dashboard. It uses two primary types of signals, signs and symptoms. Signs are objective, measurable data points, like a fever, a rash, or high blood pressure. Others can observe them. Symptoms are subjective experiences, like fatigue, pain, or dizziness. Only you can feel them. When either appears persistently or unusually, it's not a glitch, it's an alarm. Let's decode some of the most common, yet scientifically significant alarms. Persistent fatigue isn't just about sleep. Scientifically, it can mean your cells are energy-starved. In hypothyroidism, a lack of thyroid hormone slows your cellular metabolism. In anemia, a lack of iron or red blood cells means less oxygen is delivered to your tissues, crippling their energy production. Your skin is a barrier and a warning screen. Jaundice, the yellowing of the skin, is a direct result of a buildup of bilirubin, a waste product your liver is failing to process. A changing mole can represent a failure in cellular DNA repair mechanisms, leading to uncontrolled growth, a hallmark of cancer. Significant weight change, without lifestyle shifts, points to a dysregulated metabolic system. Unexplained weight loss can be driven by an overactive thyroid, accelerating your basal metabolic rate. Unexplained weight gain can be the opposite, or it can be linked to insulin resistance, where your cells become deaf to the hormone that tells them to absorb energy from blood sugar. Swelling in the ankles, known as edema, is a fluid dynamics problem. It often occurs when there's increased pressure in the blood vessels, or a decrease in proteins that hold fluid in the bloodstream. This can be a sign of the heart struggling to pump effectively, or the kidneys failing to filter and excrete excess fluid and salts. So, how should you respond to these biological alarms? Follow the scientific method. Observe and log data. Be a detective for your own body. Keep a health journal. Note the symptom, its frequency, duration, and potential triggers. Data is power. Research from reliable sources. Use peer-reviewed medical sites and established institutions. Avoid anecdotal forums. Form a hypothesis with a professional. This is the most critical step. Bring your data to a doctor. They are the expert who can run tests, the ultimate diagnostic tools, to prove or disprove the hypothesis about what's wrong. Trust your instincts. You are the primary observer of your own complex system. If an alarm keeps ringing, be persistent in seeking an answer. Your body's unusual signs are not a language of fear, but one of information. By understanding the science behind the signals, you move from being a passive passenger to the active, empowered pilot of your own health. Listen closely. What is your body saying today?